Okay, Assalamu alaikum everyone. My name is Dr. Batul Zehra, and today in association with Masters of Medical Knowledge MMK Hub Academy, we are going to study the topic of cholinergic drugs. So let's begin. Now we have already talked about two types of cholinomimetics, direct and indirect acting. So first we're going to discuss about the direct acting. Direct acting are those which are directly acting on the receptors on the postganglionic nerve fibers. So over here you can see the chemistry, absorption, metabolism by cholinesterase, duration, and administration. Basically, last three things are most important for us, but let us just talk about them in a very brief overview. Acetylcholine is quaternary and polar. Carbachol is quaternary and polar. Betanicol is quaternary and polar. So basically, all of these three have the same chemistry except pilocarpine, which is tertiary and non-polar. So what is basically meant by polar and non-polar? Non-polar are basically lipid soluble, so they can act on the central nervous system, and all those which are polar are water soluble and they can't go or pass the CNS. Now we talk about the absorption. Acetylcholine will not going to be absorbed, and the rest, carbachol will be better absorbed than acetylcholine, and betanicol will be better absorbed than acetylcholine, and pilocarpine will completely absorbed. Why is that so? Because as I've told you before, I'm sorry, that these three are polar, so obviously they can't go into the central nervous system. And as pilocarpine is completely non-polar, which means lipid soluble, and lipid soluble substances are easily absorbed, so it have a complete absorption. Now we talk about the metabolism by cholinesterase. As I've told you before, that acetylcholine is the only neurotransmitter over here, or the drug which will be metabolized by cholinesterase, and the rest will not be metabolized. Now, duration of action, acetylcholine have the shortest duration of action. Carbachol and betanicol and pilocarpine have equally longer. And the administration, acetylcholine is mostly used for IV or eye drops, and carbachol can be used in all types like orally, eye drops, and subcutaneous, but not for IV. Betanicol can be used for oral drops or subcutaneous, and pilocarpine can be used orally as a tablet and also for eye drops. Now we see the receptors. Acetylcholine, carbachol, they both are non-selective. Why is that so? Because they're working on the muscarinic and nicotinic both. However, betanicol, pilocarpine, and sibimylene are working on the muscarinic receptors only, so they will not going to be work on nicotinic receptors. So you can see over here in this section, nicotinic, acetylcholine, and carbachol are only working, but not the others. And as you know that all of them are working on the muscarinic receptors, so all have muscarinic action. Selectivity, as I told you before, acetylcholine will not going to have. Carbachol, acetylcholine is not having selectivity. There is another reason, because all the preganglionic fibers are releasing acetylcholine, and parasympathetic fibers postganglionic are also releasing acetylcholine. So obviously it is non-selective. And carbachol is working in the eye, GIT, urinary bladder. Betanicol is also working in GIT and urinary bladder. Pilocarpine is basically working on the eye, but also on exocrine glands. And sibimylene is only working on the exocrine glands. Now uses, acetylcholine have no use in the market, so basically it is not available. Carbachol and pilocarpine are used in glaucoma. Betanicol is used for paralytic ileus because it's working in the GIT, and for urinary retention because it's working in the urinary bladder. And pilocarpine and sibimylene are used for xerostomia. Xerostomia means dry mouth, and sibimylene is working for Sjogren's syndrome. In Sjogren's syndrome, we have dry mouth as well as dry eyes. Now we can see the direct action. The most important drugs are neostigmin, physostigmin, pyridostigmin, and ambinomian. Neostigmin have nicotinic and muscarinic action, and it is only have mechanism of action for half an hour to 2 hours. It's polar. Uses are in myasthenia gravis, treatment of paralytic ileus, urinary retention, curare toxicity. Pfizer segment is nicotinic and muscarinic, as well as having action in CNS. It is lipid soluble, that's why it's working in CNS. So used for glaucoma and atropine toxicity. Mechanism of action is for half an hour to 2 hours. Hydrous segment is nicotinic and muscarinic. Mechanism of action is 3 to 6 hours. It's polar. It's using in myasthenia gravis treatment. And aminomyum is nicotinic and muscarinic, 4 to 8 hours. Its mechanism of action and it's polar, so you also use in myasthenia gravis. So you can see that all of these drugs are used in myasthenia gravis specifically. Now we talk about the indirect cholinomimetics, which are also known as anticholinesterases. And I've told you the mechanism of action before that they are increasing the amount of acetylcholine in the synapse, and they will also work on both nicotine and muscarine. So first we're going to talk about the reversible ones, which have therapeutic action. The short is acting reversible one are edrophonium, as I've told before. It is an alcohol and forms weak hydrogen bond with acetylcholinesterase enzyme. And the intermediate acting ones are the carbamates, and they bind two sides of cholinesterase enzyme, and all are polar except physostigmine. And you can remember the carbamates over here by the suffix of stigmine, physostigmine, pyridostigmine, neostigmine. And they are basically used for myasthenia gravis treatment. Next, we have very long-acting, irreversible indirect cholinomimetics. And when we talk about the irreversible, we know they are toxic. So they have very long duration of action, form very stable covalent bond with cholinesterase, and all phosphates are lipid soluble, which means they can act on the CNS except ecothiophate, which is polar. Now we will going to talk about the pharmacological effects of anticholinesterase. As I have told you before, they have both N and M actions, so as well as CNS. So nicotinic action are similar to nicotine. It mediates fast synaptic transmission of nerve impulses, and muscarinic actions are similar to acetylcholine, like meiosis, bradycardia, bronchoconstriction, increased motility, secretion of exocrine glands, sweating, and lacrimation. Now, indirect cholinomimetics, the important ones are edrophonium, neostigmine, physostigmine, ambinomium, and pyridostigmine, ecothiophate, and donepezil. Edrophonium, as I've told you before, is very short acting, so its mechanism of action is only 5 to 15 minutes. That's why we use it for the diagnosis of myasthenia gravis. We inject it into a patient, and if the patient of myasthenia gravis started to have some mechanism action, like they are moving their limbs, so we can diagnose myasthenia gravis because it's working. Now, neostigmine is also short acting, 0.5 to 2 hours, and also used for myasthenia gravis treatment, paralytic ileus, urinary detention, and curare toxicity. And edrophonium, neostigmine, all of these drugs are acting on both muscarinic and nicotinic. Then we have physostigmine, which is also working on CNS as it is lipid soluble, very short acting, 0.5 to 2 hours, used for glaucoma and atropine toxicity. Ambinomium and pyridostigmine are also short acting, 3 to 6 hours, polar, so also used for myasthenia gravis treatment. Ecothiophate is a very long acting and polar, so it can be used in glaucoma. And donepezil is also lipid soluble, hence it is used for in the Alzheimer's disease. Now, there will be now we're going to talk about the toxicity or adverse effects of the cholinergic drugs, and this is basically seen in organophosphate poisoning because it is a irreversible drug. So it leads to bradycardia, hypotension, sweating and salivation, bronchospasm, diarrhea, intestinal cramps, and colic, blurred vision. Basically, the action of parasympathetic system is heightened or working more than required, hence will lead to these toxic effects. And now, cholinomimetics are contraindicated in which patients? Bronchial asthma, as we all know that in parasympathetic nervous system, there will be bronchoconstriction. So we do not need our patient to have bronchoconstriction if he having bronchial asthma. Then our muscarinic drugs are also doing the peristalsis, and if there will be more than excess of peristalsis, so it will not going to help the peptic ulcer patients, hence contraindicated. And It was also contraindicated in angina pectoris because we know that cholinomimetics are decreasing the heart rate leading to bradycardia, which is not very helpful for angina pectoris patients. And it is also not contraindicated in incontinence because basically there will be increased urinary action. And lastly, it is also contraindicated in intestinal obstruction because once again, cholinomimetics are used for peristalsis and is contraindicated. So this is a summary for cholinomimetics and their uses. Let's quickly revise. In eye, it is used for treatment of glaucoma, especially our drug pilocarpine, which is a direct acting muscarinic agonist. And also physostigmine in ecothiophrate can be used, which are indirect cholinomimetics. For urinary retention and paralytic ileus, the direct acting drug is betanacol and indirect is neostigmine. For myasthenia gravis, we will only going to use the indirect cholinomimetics, which are pyridostigmine, neostigmine, and ambinomian. And for xerostomia, we are using pilocarpine and cevimeline, which can be also used in Sjogren's syndrome. And for Alzheimer's disease, we use donepezil and sometimes dectin as well. So that's all about cholinomimetics. Thank you so much, guys. And if you have any question regarding today's lecture, so you can text me in the lecture box. Thank you so much.